what are you going to do after graduation? And that's the big question. What are you going to do after graduation? So that's the title of this presentation: Ready, Set, Graduate. Do a GPR. The 9 reasons why postgrad advanced dental education is not optional. It's not optional. So over the next 25 minutes, I want to share with you a major dilemma that is facing many new dentists and some strategies that support several reasons why this action of doing a GPR or AGD or postgrad residency must be done. Just so you know, I'm not paid or sponsored by any dental organization or manufacturer. All these viewpoints are mine and mine alone. And the content is based off of my experiences, my collaborations and training over the last 20 years. So objectives, purpose. So we're going to identify the 9 reasons why residency training is not optional. We're going to learn a little bit about how postgrad training impacts and influences your future professional development and your success. Some ways to boost your credentials and your own uniqueness as a specialty candidate and also as a potential private practice associate. And also produce a call of action and hopefully a decision to help you and be a resource to you for your future success. So we talked about the 9 reasons. We talked about how 8 years and $300,000 is going to put you behind the 8 ball, as someone said. You know, sometimes you don't know what you don't know until you get into a situation where you realize you don't know it. Number 3, how it's really going to be nice to finally get a paycheck while you're actually learning, totally different than what you're experiencing now in dental school. And 4, not having to worry about student loans, being able to defer and get some more information about some loan repayment programs. Number 5, having the ability to network and collaborate with specialists and other colleagues from different schools. The opportunity to get prepared for some specialty programs, doing a residency will get you some more experience, a lot of which most specialty programs want you to have. And 7, 8, and 9 as well. So, foolish. This is why I think it's foolish that many people do not even consider doing a residency. And it's foolish because it's not, I don't think it's, one of those things where it may not, granted, it may not be for everyone, but it just makes good sense, good judgment to do a residency to learn more, because unfortunately, guys that are ladies and gents that are D2, D3, D4s, Maryland's a great school. You've been paying a lot of money, but it's not going to prepare you completely for what you're going to be faced with when you leave. So that's why I think it's foolish. And why is it foolish? It's because you have the opportunity for you to be the best you ever. The best you ever. And that opportunity is key. These first 5 years out of school is going to be very, very key for you to develop as a clinician and develop some really good habits clinically, but also interpersonally as well. Most of our learning comes from out of failures, not from successes. I don't know if you guys have heard this quote before, but I don't know if that's 100% true. I think you have to learn from your failures as much as you learn from your successes as well. But not having the opportunity to do a residency and see where you can grow and how you can to be able to learn from your failures in an environment that's not going to demean you or cause you any harm. I think that's the best way to learn. versus learning the hard way, meaning going out in private practice. Now it's your license, and the things that you don't know about, you're working on patients, doing procedures that you're not familiar with. Maybe you've only done 2 root canals, 2 molar root canals, and now you're expected to perform at the level of the standard of care, which could be the standard of care as to how the endodontist does it. So I don't want you guys to learn the hard way. To succeed, you must fail a few times, but don't fail yourself into thinking that doing a GPR is optional. All right. These days, especially in many dental schools where patients are not accepting a lot of treatment, or where schools are actually expanding, but the patient populations are shrinking, you're not having a lot of exposure to a lot of procedures. So this is another reason why I don't think it's optional. Success, in my opinion, success comes to those that plan and do, but the action of doing is probably one of the most important indicators of your success. The doing part is very, very key. What you do and how you do it is a game changer for your career, I think. And in this case, you must do a post-grad residency. Again, you must do a post-grad residency for all the reasons that we mentioned above, but also because, your survival after dental school and your success is really dependent on it. So for those students that are there, my passion is to help you guys. I've been to the school a couple times recently in the past, and if I can guide you through this process of considering or applying through residency programs, just let me know. I've helped over 180 of our residents over these last 6 years, both new dentists that have just graduated and also residents that are applying to specialty programs too. Every year we get about 10 of our 38 residents that are applying to specialty programs, and I've been able to help them as well. So again, just remember this. If you don't take anything away from tonight's presentation, take away the fact that you don't know what you don't know, and there's many advantages of doing a residency, and there's no need to rush into thinking that you have to pay off these loans immediately. Your residency training is what's going to allow you to command a higher salary and produce more and have more certainty in the type of care that you're being able to deliver in exchange for happiness, helping patients, but also salary-wise as well.
Hey, this is Dr. Darwin, your new dentist coach. Hey, look, it's residency time. It's residency application time. And the biggest question that a lot of people have is, how do I prepare my application? So look, if you're struggling in getting your information together, your CV, your personal statement, or you're ready but not prepared for your interviews, reach out to me ASAP, right? Through my group, Dental Residency Headquarters, we can help you. We can help you get ready for this residency cycle so that you're able to do this. We want you to match into residency cycle this year, all right? But you got some work to do. If you need some help with that application, shoot me an email at newdentistcoach@gmail.com, newdentistcoach@gmail.com. And through our program called Get Into Dental Residency, we can help you. We can help you, but you got to hurry up because residency application is right now. It's right now. So shoot me an email right now. All right, let's get back to this episode.
How you doing, Dr. Hayes?
Hey, how you doing?
I'm doing well, sir. Thank you for coming out tonight.
You're
actually talking to us tonight.
Yes, I know what you meant.
I just have a general question. When it comes to the post-grad programs, why GPR over AGD? I know probably you've talked about it before, but I just wanted to hear from you today.
Well, I think the biggest difference between an AGD and a GPR is that a GPR is hospital-based dentistry, right?
Yes, sir.
And there are two required rotations that you must have in a GPR program. You have a rotation in anesthesia, and you have a rotation either in emergency medicine or family medicine or urgent care. Also, with a GPR program, you're going to be, I would say you're going to be on call typically, and you're dealing a little bit more on the medical side. You're dealing a little bit more with patients that have complex medical histories, and how you manage them from a medicine standpoint, and how what you're going to be doing in dentistry, how that's going to impact their overall care. So I think that those are the biggest differences. In some of the AEGD programs, you may have more areas of maybe implants being placed. You may have more cosmetic dentistry, being done. It really just depends on the program. Really just depends on the program and what are some of the guidelines and what the curriculum is like.
Okay, thank you very much. Appreciate it.
I would also say, if you're thinking about a specialty program or something similar, then a GPR may be a little bit more beneficial depending on what your rotations and what the curriculum is like. And I will tell you, not all GPR programs are created equal. Just because it says GPR doesn't mean that all of them have a comprehensive care focus. Does not mean all of them have rotations in the specialty areas. And, if you're thinking about oral surgery, you want to have a rotation in the oral surgery department, whether it be a month or 8 weeks, 10 weeks, whatever it is. If you're thinking about pedo, you want a GPR or AGD program where you have a rotation in pedo, when you're seeing kids 12 and under. So, those are some of the things that you have to kind of sift through and look through to determine, do you want to be on call? We've got residents that that say they want to be on call, and then when they're on call, they don't want to be on call. So we always emphasize, if you don't want to be on call, do not do our GPR program, because you will be on call, even though it is very minimal. I mean, you're on call maybe 4 times a month for 6 months. Of the 12 months, you're only on call 6 months. 6 times 4, 24 times. It's not a very big or a hefty commitment as far as time. And that's because we have a large program. Some of the other smaller GPR programs that may have only 4 people, you may be on call, 7 days in a row, once a week for 12 weeks or for 12 months. So there's a lot more exposure. So again, you have to look through those programs to really see what you're looking for and what the goals and objectives of the program is, and how that aligns with where you kind of see yourself going in the next 3 to 5 years, because that this time is very key.
Yes, sir. Thank you. Appreciate you.
If you have more questions, you can shoot me an email, okay?
I will. Thank you.
Who else has a question? Shoot me an email at newdentistcoach@gmail.com, newdentistcoach@gmail.com.
Dr. Hayes, is it too late for one more question?
No, let's go. Let's do it.
Hi, Dr. Hayes. How are you?
Hey, I know you.
Yes, you do. It's Ariel. I have a question. I was wondering, for those people who maybe want to specialize or anything like that, but kind of want to get more experience in like what areas they would really want to specialize in, doing a GPR at like a program with specialty you want to potentially do, does that help you maybe to get into the specialty at that GPR program?
Well, I will tell you this, nothing is guaranteed.
Right. Mm-hmm.
Right. So like, for example, at our program, we have a pedo residency. We also have ortho residency. And even though every year we may have in that entering class, for us, ortho is is 3 years and pedo is 2 years. The last, I would say 5 to 6 years, we've always had at least one former resident, GPR resident, that has gotten admitted or has gotten one of those slots. But I would say that that's not necessarily, it's not necessarily guaranteed. Now, what's nice about doing a GPR at any location where they also have other specialty programs is, depending on their curriculum, there may be a rotation through that department or through that specialty section, right? What's nice about that is not only are you going to get that exposure, but you also get a chance to meet and talk with those faculty members and residents that may be making the selection decisions when it comes to new spots every year, right? So I think that's a great advantage for those that are doing GPRs and at locations that also have, or programs that also have, other specialty programs. But you have to be intentional. You have to be strategic in the sense that if you're afforded the opportunity to rotate, you don't want to blow off that rotation. Or if you're afforded the opportunity to come in on a Saturday and go into the pedo department and observe and then also do some hands-on stuff, you don't want to mess up and blow off that opportunity. We have had residents that have done that, said they were interested in pedo. We've had residents, even second-year residents, that have that do like a mini rotation through an area of interest. They have about 20% of their clinic time. They can go into ortho for the day or go to pedo or oral surgery or what have you. And we pair them up intentionally with that department. And we've had people that are paired up that just don't show up or don't want to see patients, or the day they're supposed to go on a Tuesday or on a Wednesday, they call out sick. So that doesn't do well and doesn't do you well as far as potential letters of recommendation. And, someone who's going to speak on your behalf for those specialty applications, because I will tell you, for some programs, they want a letter of recommendation from a colleague that's a pediatric dentist, a colleague that's an orthodontist, a colleague that's an oral surgeon. They're looking for those types of letters of recommendation. And so it may be more challenging to get those if you're at a GPR program that does not have those specialty areas that you're looking into. How's that help? Is that good?
That was very helpful, yes. Thank
Got one more? Got one more? Y'all waking up now, huh?
Hi, Dr. Hayes. How are you? I'm Tama. I'm a D2. Hi.
I think I know your mom.
Yeah, you do. Yeah.
Ah.
So I'm going to be applying for residencies in New York, and I wanted to know when's the best time to do that. Is it next summer, like my D3 summer?
What year are you?
D2.
D2.
Yeah.
So you're going into your D3 year.
Yeah.
Okay. I mean, I think this year, I think the main thing you need to focus on is, of course, clinic, but also I would start developing your list of programs. So you've done the hard part already. You already know you want the area that you want to do your residency in. It's New York.
Yeah.
The challenge is there are more residencies in New York
And everywhere else.
right?
That's
So
true.
between Manhattan, the Bronx, Brooklyn, and upstate New York, I think they have almost close to nearly 30 or 40% of all the residencies.
Yeah.
So I think this D3 year before, like this time next year, we should have this conversation again. But between now and then, you should be coming together and making a list.
Okay.
Making a list of all the programs that you may have interest in, and start investigating them a little bit. I think the biggest help is going to be going online, checking out the websites. You can go to adia.org and through the PASS application service, and they have a list of all the residency programs, who the program directors are. They may have a little blurb about the different programs, but I think for the most part, you're going to have to start your list. And sometime next summer, between D3 and D4, I will tell you, you want to go do some visits.
Okay.
right? You're lucky because that's home for you.
Right.
So, going home to kind of spend some time to look at some programs is going to be beneficial. And I think that's one of the ways that's going to help you get out of obscurity, right?
Yeah.
Again, you saw the slide about how many people that apply to all these different programs. About 10,000 people apply to GPR AGD programs, but only less than 10% actually get accepted. It might be a little bit higher than that, but you need to find ways that allows you to get your face in front of people.
Right.
Because look, everybody's going to have a pass application, right? Everybody's going to have a pass application. Everyone's going to have letters of recommendation, et cetera, et cetera. What are some of the things that are going to make you different? And one of the things is actually taking the time out and going to visit the programs so they can see you, you can see them. Go, maybe try to schedule a tour. Maybe you can meet the program director or some of the residents, whatever it is. I know some programs will allow you to do that for the day if they have it set up. But I think that's what's going to help you not only in the eyes of the programs, but also help you kind of sift through the long list of all the programs that are in New York. And again, just because they're GPR, just because they're AGD, does not mean they are all created equal.
Right.
The only thing that's consistent is the CODA standards. All of us have the same. All the GPR programs have to follow the same standard. How we do it is totally up to our own interpretation. So you'll have different programs with different focuses, different objectives, and that's what you have to kind of sift through to figure out.
Awesome.
But there are a lot of Maryland folks that are up in New York right now. Dr. Otto, Tiffany's there, and Dr. Dukamaya. Somebody else is at Harlem. So you also have that's also a good resource for you too. Check with the rest of the SNDA members, especially the D4s that remember the ones that just graduated, and get in contact with them too. I named 3 people that are at 3 different programs, and they also went through that same process that you're going to go through, so they can help you through that.
Help assist me. Okay.